Welcome. My name is Jennifer Roeder. I'm a communications consultant for APFED, and I'll be moderating today's webinar. Today, Joanne Mitchell-McLaren, a patient engagement liaison with GSK, will talk with us about asthma and answer the question, could it be more than asthma? Joanne has a strong passion for educating and advocating for patients and caregivers. She has more than 40 years of experience caring for patients, including 23 years within the pharmaceutical industry. Welcome, Joanne.
Thank you, Jennifer. Appreciate the invitation to be here today. And we will get started with our program. Awesome. So good afternoon or good morning. It depends on where you are. As Jennifer has said, my name is Joanne Mitchell-McLaren. And today we are going to be looking at, is it more than just bad asthma? As a patient engagement liaison for GSK and an advocate, I am here today really to give you information in hopes of empowering you so that every interaction you have with your provider, it will give you the tools and equipment, perhaps some questions that may stir in your mind of things that you may desire to inquire about with your providers. And so today, what I'd like to do is we're going to talk about a few things, and keep in mind that everything we discuss, it is not intended to be medical advice, but it is intended to just empower you. So how well do you understand what asthma is? And when is asthma more than just bad asthma? And what's the impact that asthma may have on your life or your loved one's life? What are your goals for control? For each individual, I should say this may look a little different. And what actions can you take in order to ensure that those goals are being met? So starting here, we want to talk about how well do you understand asthma? Well, first and foremost, let's discuss and define what asthma is. It is a chronic long-term disease that inflames and narrows the airways of your lungs, making it extremely difficult to breathe at times. So here's an illustration. On the left of the screen, you have what a healthy lung that doesn't have asthma, what it looks like. And there's a depiction here of what relaxed, smooth muscles in those blue bands and what a normal airway is. The airway is wide and air is exchanging well in this illustration. On the other side, where we have asthma to the right, if you note, there are tightened, smooth muscles. So those bands are showing some inflammation. And then you also have mucus that is oftentimes present. Therefore, if you look from left to right, the airway passage is now extremely narrow because of inflammation. Asthma, we know because it is a chronic disease, it can't be cured, but asthma can be managed. So today, no matter where you are in your journey with asthma, or if you have a rare form of asthma, I want you to know, although it cannot be cured, it certainly can be managed. Now, a pop quiz for all of you out there who are experts. Asthma, does it affect more than 25 million people in the US? Does it affect 1 in 13 people? Can it not be cured? Can it be managed? Or is the answer E, all the above? Well, you guys are a really sharp team today. I think all of you, we got 100% response. It is all the above. Now, understanding asthma. And here we're going to talk about some of the basics. More than 25 million people have asthma in the United States, that is documented. And in fact, there is that 1 in 13 people that has asthma. Just think about that, 1 in 13. And if you have asthma, this really signifies that you're not alone in your journey. So is there a type? So we're going to get in and talk a little bit more about the types of asthma. Intermittent asthma. Some of you may have heard this term. And with intermittent asthma, symptoms occur no more than 2 times a month. And they don't usually interfere with your ability to run or walk or exercise or go out with friends and do those kinds of things. Now we have what we call mild persistent, moderate persistent, and severe asthma. So when we look at that moderate persistent, symptoms occur more than twice per week, but they don't happen every day. The moderate persistent symptoms typically occur every day. So you'll hear a person who has moderate persistent asthma say, every day I'm wheezing. You know what? Every day I have to cut my activities a little bit shorter. And then when we look at severe persistent asthma, symptoms occur throughout the day and they seriously limit normal activity. This can be a problem. So how do you define what bad asthma is? Well, have you ever thought thoughts like some of these on the screen? People think it's just asthma. Some have described it as a 25-pound rock in the center of my chest all the time. Some have said it's like a giant wave. The wave is nature and I have no control over what is happening. Others have stated things like I have to schedule everything around my lungs. Or my family panics if I cough or if I wheeze. I can't do the kinds of things I used to love, like camping or taking my son and showing him things. And some say I have lowered my sense of normal. So today, as we continue to go through this presentation, I want you to think about these quotes, and maybe you have quotes that are your own and things that you've said or thought about or experienced, or a family member, if you're a parent or a loved one caring for someone. Severe asthma can also be referred to uncontrolled asthma, difficult to treat asthma, therapy-resistant asthma. And, when I think about therapy-resistant asthma, many patients will often say, well, I've been on 10 different inhalers and none of them seem to control my asthma. But keep in mind, we're referring and we're talking about right now that severe component of asthma. So severe asthma, signs and symptoms. So with severe asthma, you take all of your daily medications and you follow your provider's advice, but you still experience everything we talked about, that lack of control for your symptoms. Some folks say, well, you know what, I take my inhaler and it's the one that I'm supposed to take every day that is supposed to control my symptoms, but yet I find myself short of breath, yet I find myself wheezing uncontrollably. And then here, 2 or more courses of oral steroids. Some folks tell you, you know what, I've had more than one trip to the ER, and each of those visits, I've actually been given a 5-day course of steroids because my symptoms continue to persist. And then for those who have gone because of a severe attack, hospitalizations due to their asthma attack continues to occur over years. So keep in mind that these are all areas where the asthma is not under control and it's not intermittent. It's not just persistent, but it is a severe episode of asthma. So when we look at severe asthma, the risk of uncontrolled asthma, repeated asthma attacks and inflammation caused by long-term uncontrolled asthma that goes unchecked can lead to some serious complications. So more asthma attacks, more exacerbations. Now, this is the first time we're using the terminology exacerbations. And for those of you who may be new to the term, just keep in mind, it's when your disease is then out of control. That asthma is out of control. You continue to flare. You're having shorter breath. You're having that weight that feels like it's on your chest. And then what you cannot see is the damage that it continues to do to the lungs. So today, my rhetorical question to all of you is, are control and severity the same? Think about that. Well, of course, the screen tells you absolutely it is not. Now, severe asthma, my question today is, are you in control or are you simply coping, right? And we know that approximately 60% of adult patients considered that they're under control, 60%. Lack of control could be any of the following. And I really want you to zoom in and pay particular notice to what a lack of control could look like. One, hospitalization for your asthma. If you're truly under control, there shouldn't be hospitalizations not for the asthma component. A flare-up or an asthma attack. That's not control. Increased asthma symptoms. So are you wheezing and short of breath and coughing and waking up in the middle of the night with coughing episodes? These things mean that your asthma is not controlled. So there are trips to the emergency room for asthma. So today, my desire is to empower you to take control and to perhaps look at your component of asthma a little differently. If you find that some of these things that we talked about would indicate that you're not in control as much as you'd like to be. And coping with your asthma isn't the same as control. You know, we know all the time people say, oh, I'm in control, but you're using a rescue inhaler 4 times a day. That's not control. So severe asthma, you have the power and the ability to take control. And control could look like a number of things. Number one, fewer symptoms such as wheezing and or coughing. Number two, better sleep, the quality of sleep that you get. You're sleeping through the night because you're not waking up wheezing. You're not waking up short of breath. Number three, fewer missed days of work or school. And number four, taking part in more physical activities. Many patients will often say, I'm in control, but I don't go to the gym anymore. That's not control. And then fewer hospital visits. We live in a climate where, you know, people don't really want to go to ERs because they're overcrowded. And if you're under control with your asthma, you shouldn't have to. So we want to look at these asthma goals. You can better control your asthma. So we talked earlier, and I mentioned a few slides ago, with severe asthma is control plus severity. Are they the same? Well, severity is really determined by your provider based on a number of factors, including your medical history and including your medications, past, present, and future medications. Your family's medical history. Is there a link, a genetic link? Perhaps your mom, your dad, your siblings had a history. And then a physical exam. So all of these things are taken into account. And number four, lung function tests, such as spirometry or methylcholine challenge, peak flow, and exhaled nitric oxide. All of these factors your providers may include as part of a factor that they're using to talk about the severity of your asthma. And then five, frequency, severity, and the impact of your symptoms. Like, how are those symptoms impacting your life, your quality of life? Now, there are two common types of severe asthma. So if your provider thinks that you might have severe asthma, it could be one or the other. So it could be a severe non-allergic type of asthma or a severe allergic asthma, right? So here we want to talk about the common types. So with severe asthma, we know there is a terminology that's often referred to as eosinophilic, neutrophilic, or adult onset, or asthma with obesity. And then there's asthma with reduced lung function. So multiple tests can certainly be used to determine what type of severe asthma you may have, including skin tests, blood tests, and lung function tests. And your provider may do 1 and 2, or maybe all 3, because they're looking for a comprehensive picture. It's like putting the puzzles all together. So with severe asthma, a simple blood test that can be used to determine the type of severe asthma you may have, including your neutrophils, IgE, and eosinophils. Keep in mind, eosinophils are simply a type of white blood cell that can play an important role in your immune system, but when elevated, can signal that you have severe asthma. Now, approximately 50% of severe asthma patients have elevated levels of eosinophils. And you can only get this is a blood test that must be done. So today I encourage you to ask your provider for a simple blood test. If you find yourself, as we review those severe symptoms, the things that happen, whether you're using, a rescue inhaler, many times you're coughing, you're constantly wheezing, and you're ending up in an urgent care or an ER. Simply take the opportunity. You live this asthma lifestyle. And so as a result, you want to make sure if you're continuing to have symptoms, or perhaps what medication, your regimen that you're on, and it just seems as if, no matter that you're compliant, you're taking everything that you're supposed to, you're still constantly wheezing and coughing and in the ER and getting steroids. You want to make sure you are empowered enough to say to your provider, because maybe they just didn't think of it, could you possibly do an eosinophil count to help determine the type of severe asthma that you may have? Now, severe allergic asthma, it's in the air and it's caused by an allergen. And these can include dust mites, indoor and outdoor mold, pets, food sensitivities. So your provider can perform blood and skin testing for these particular allergens. So today, what's the impact of severe asthma on your life? How are you dealing with it on a daily basis? Are you in control, or is your asthma actually keeping you from living your best life? And is the impact personal? I should say so. And is asthma interfering with your sleep? When I think of the quality of sleep, if I lose, and I don't have asthma or any chronic illnesses, but if I don't sleep well for one night, that's a problem going into the next day. I'm overtired. I just don't have the right amount of energy. So if you're coughing all night, it's not giving way for you to have quality the next day and thinking clarity. So are you able to walk up the stairs without getting winded? Can you do that? And are you able to run errands without having to stop and catch your breath? And, this brings to mind, I spoke with a young lady, she was in her 40s, so I consider that young. And she said, you know what? There are times when I go to the grocery store, I can't do all of my shopping at one time. She knows the store well because her asthma, she can't catch her breath. She's short of breath. She's out of energy. So what she does is she'll do half of the grocery store and get half groceries, and then she goes back the next day. That's not quality living. That's not asthma control. Is the impact of your severe asthma, is it impacting your social life? Well, is asthma interfering with a dinner night or a movie or a sporting event plans that you had with friends or family? And are you actually putting away like weekend getaways? Are you saying to your girlfriends, if it's a, spa weekend, I can't go because you know what, the weather's hot and I'm not sure if I'm going to have an exacerbation? And are you thinking twice about booking any air travel for fear of what may occur on an airplane when you're 10,000, 20,000 feet in the air? What is that like? And I took a flight recently, and there was a gentleman who actually had a severe asthma attack, and they quickly called for a doctor or a nurse practitioner on board of that flight to intervene. Thank God the gentleman made it. But these are things that people often think about when their asthma is not in control. And what is really the impact on a family? If you're a husband, a wife, if the person's coughing all night, you're not only awake all night, but so are they. Is it causing the family not to take trips? Is asthma preventing you from throwing a birthday party like you used to? Has hosting Sunday dinners really become a thing of the past because you're so winded you just can't pull it together? And do you often miss, games, whether it's for your children or your grandchildren, for the fear of what may happen? And the other question that I have is the impact, what is the impact to your routine, right? And here are a few things to think about. Are you still able to do your household chores without feeling breathless, or have you hired a cleaner? Do you think twice about gardening? This was your favorite pastime, but now you're afraid to go outside because you're fearful of an asthma attack in the garden. And do you often leave walking the dog to the dog walker in the neighborhood because you can no longer keep up? How is it really impacting your work-life balance? So, are you asking to travel less for work because of your asthma? Your inability to breathe appropriately? Are you using more sick days because of attacks that you frequently have? And are you having trouble performing physical tasks? Perhaps you work and it requires that you have physical activities that requires you to move things, to push things, to walk from one building to the next. Are you able to do that effectively? And is the impact, at school, are you missing days of school, which cause you to get behind on assignments? Are you missing more than you have in the past because your asthma is just getting in control? So I know we covered a lot of things, but there are things really to cause you to think. And here are some other things I want you to think about in collaboration with your asthma. If you've ever had feelings like those that are listed here on the screen, you're anxious, you're afraid, you're scared, you're stressed, you're always thinking about your asthma and it's so unpredictable, isolated, and you're frustrated. Do you ever feel like you're just in the dark and like you're alone, like I'm the only one going through this? Well, I can guarantee you you're not. In the beginning, we mentioned that there were 25 million people living with asthma. Now, the feelings that we would love for you to have in reference to your asthma is to be confident and open and hopeful and aware and forward looking, not looking in the back. And having insecurities is not We don't want you insecure. We want you relaxed and resourceful and in control and having that can-do attitude so that you're able to continue to live your best life, but be prepared. I always say it's better to be prepared than to have to get prepared. So you have to know what type of asthma you're dealing with and what type of treatment will help you to live a better life. So today I encourage you to talk to your providers about the impact that your asthma symptoms are having on your daily life and your goals for control. Because when you talk to a provider, it helps them to better help you. Remember, asthma doesn't have to control your entire life. You shouldn't have to miss out on things. But being an empowered and informed patient will give you a better seat when you walk into your provider's office to talk about some of the things you've learned here today. So with severe asthma, what are your goals for control? Well, here are some examples. I want to cough and wheeze a whole lot less. I want to cut down on how much I use rescue inhalers or oral steroids. And I want to be able to go to events with my family and my colleagues and my friends and not have to say no because one of my triggers may be present, right? It seems like such a normal, simple thing, but this is all part of you taking control. And then other things like I'd like to run errands without getting winded. Can you imagine what it's like to know that you have a full grocery list, but you can only do half of that list because you're not in control? And avoiding ERs. Who doesn't want to avoid the ER no matter what the reason, right? And you'd like to focus on missing fewer days of school or work. So today we have many things here at GSK, and one is a discussion around a doctor discussion guide, and I like to say a provider, because oftentimes folks have more than just a doctor. You have PAs and NPs you see. Here is something that you can say, you know what, we can be open about what's happening to you and how your asthma is affecting you. So you make a list of questions you want to ask. And then you share the list with the nurse who checks you in ahead of time, if you'd like. Take along a friend or family member to be an extra set of ears and eyes. And then follow up on anything that you don't have time to cover during that appointment. These are simple tools. And in asking for additional testing. If you're not certain whether you have severe asthma, go in and ask for that eosinophil blood test. It's a simple way to figure it out. You can take action, indeed, by doing what? Talk to your provider about asthma, its impact on you and your family, and what your goals for treatment really are. Create an asthma action plan with your provider. Use the provider discussion guide. GSK has many resources that are available to you. Visit asthma.com for more information, tools, and tips on living with asthma. And find support groups that participate in seminars. In your community, you're not alone. This is something that many people live with every day. So today, I trust that what we've shared with you today is something that will help you or a family member to live a better and a healthier lifestyle with their asthma and take control. Now, I encourage you today, if you'd like, if there's something that we've said, here today we live in a technology world, and today you have a QR code, you have several here to choose from. If there's something here you'd like to take the asthma control test to see if you're under control, or you'd like to download an asthma journal and doctor discussion guide, or you can sign up for asthma self-care. I'm going to leave those there for a second. And with your phone, it's simple. You go to your camera, you go to the one you want, you click on it. It will ask for your email address and your name. And then you can gather these resources so that you can have something. And then, of course, to learn more about severe asthma. If you're someone and you know absolutely that you're not in the control that you would like, then I would certainly say that is key, and it'll help you to generate more questions, the questions that you'd like to ask. So I just again want to say thank you for your participation today, and I will stop sharing. And Jennifer, I will let you take over.
Fantastic. Well, thank you so much for such a wonderful presentation. And special thanks to our education partner, GSK, for their support of this webinar. You can also continue learning more about eosinophil-associated diseases by subscribing and listening to our podcast, Real Talk Eosinophilic Diseases. In the latest episode, our co-hosts Holly Nodowitz and Ryan Piansky had a live discussion at EOS Connection 2023 about conference takeaways. You can watch all the conference sessions on demand at apfed.org/conference. APFED members can even register for free as a virtual participant. You can find the episode at apfed.org/podcast, as well as on Apple Podcasts, Spotify, Audible, and more. We also encourage you to continue the discussion started today in our online community on the Inspire Network. It's a great place to connect with patients and caregivers for support. Check it out at apfed.org/connections. So please join me in thanking Joanne and GSK once more for today's wonderful webinar about asthma. We hope you'll join us for more episodes of APFED's EOS Support webinar series. If you have a question that didn't get answered today, please email mail@apfed.org, and I hope everyone has a great afternoon.